Welcome to the You Patients podcast. Today we're hosting the second episode of our mini-series EDiHTA Talks. Joining me is Andersson, an advocacy specialist who is actively involved in the project through the Patient Advisory Group. Emma works at the Association of Cancer Patients in Finland, where she has been the contact point for national HTA engagement since 2021. She coordinates the organization's international activities and has contributed several submissions to the Ministry of Social Affairs and Health, highlighting patient experiences. In this episode, we will discuss mobile health apps and their role in revolutionizing healthcare. The implementation of digital health technologies comes with challenges, particularly in harmonizing assessment criteria across Europe. The EDiHTA project aims to develop the first flexible, inclusive, and validated European health technology assessment framework for digital health technologies. Emma, welcome to the show. It's really nice to have you today with us.
Hi, Dalila. Great to join the podcast.
Together with the other patient advisories, you contribute to the development of the EDiHTA framework. Could you start by telling us a bit about your background and your role within the project?
Yeah, absolutely. And also greetings from Helsinki. And thanks for the invitation to join the podcast series. My background is in political science, and I worked at the Association of Cancer Patients in Finland since 2017. We're a national patient organization for adult cancer patients and their loved ones, and we especially focus on rare cancers. And 4 years ago, I took the role of advocacy, and this basically means involving in stakeholder engagement in both national and international working groups, for example, drafting statements, like you mentioned, on the national HTA, as well as covering the topic of survivorship and challenges working age cancer survivors face. Our HTA involvement mainly applies to medicines, but ever since I joined the EPF Digital Health working group 2 years ago, I've had the chance to learn more about patient involvement within digital health as well. And it was also through the working group that I found out about the EDiHTA framework. And I was so eager that I also attended the Data Saves Lives conference in Brussels last year. So I'm currently a member of the EDiHTA Patient Advisory Group, and what this means is basically participating in a focus group workshop, commenting on the draft report, and sharing my knowledge about the mobile health apps used in Finland, for example.
Could you tell us or show us some clues about why is patient involvement so crucial during the design phase of mobile health apps?
Yeah, sure. I think, basically the patient is the end user of the mobile health app, so there really isn't anything meaningful without the patient when health apps are developed. And of course, patients are also individuals. They come with their unique expertise from other areas of life. So I think engaging multiple patients helps to adjust the app to various needs and to also enhance user experience. And of course, when you develop something and design something, it's for something to work well. I think patient involvement is crucial and should not be neglected at all. And it's also important to note that there are various levels of health literacy in the general population, and this has an impact on the design and use of mobile health apps. First of all, patients have first-hand experience on their specific needs and disease-related concerns. So the app must meet a specific need. Otherwise, patients might not use the product. And it must also be helpful to, and most of all, build trust in applications.
And what are the main challenges or barriers patients usually face when using these type of apps?
Yeah, this is a really good question, and there are many positive features when it comes to using the apps. But when I think about challenges or barriers, I'd say that besides these positive things about the apps, well, first of all, patients want to be active, and if the app helps, for example, to report on symptoms or side effects, patients might feel safer. So when it comes to barriers or challenges, patients might be concerned about safety issues, like I mentioned, data ownership, where the data might end up with, and sometimes they might be reluctant to share their health data. And also, sometimes it's a bit of a wild west when it comes to the selection of mobile health apps. It might be overwhelming. There are many to choose from, and maybe also unclarity about transparency. So in terms of mobile health apps, thinking about how to bridge the gap of these challenges or barriers, I think a low threshold service makes it easier for patients to get the help they need. So they have something they can use, they benefit from, and if it somehow applies, for example, symptom questionnaires along with the insights they can provide, these can also reduce the need to contact healthcare professionals or every concern. So it's a benefit for both the patient and healthcare professionals, and the apps can support patient and healthcare communication. So incorporating something like this can get rid of the challenges or barriers. And also accessibility can be of concern. Accuracy and clear information, if those are lacking, or there might be trust issues or something else. So clear procedures can bring trust in themselves. So if for example, if a patient uses a medical app, for example, even the knowledge that there's someone or a focal point of contact can ease the pressure and really help build trust and reduce stress at the patient level. And when care teams collect data regularly, it also allows for more accurate and objective follow-up than, for example, maybe simply asking how the patient feels during the appointment. So there's the whole data gathering. So coming back to the truly supporting all patients, the digital tools must also be accessible, easy to use, available in multiple languages, and adaptable for different needs and abilities. And on a related topic, we ran a survey this year to assess the willingness of persons with cancer to participate in scientific research and their views on the use of health data in research. This was research, but maybe there are things that could be incorporated into mobile apps and digital solutions as well. So we got over 230 responses to the survey, and the results were really, really positive, and they show strong trust in research institutions and a significant willingness to participate in research. So a few key details about the survey that paints the big picture of how willingness patients are to be involved and share their data. So most of the respondents said that they'd be willing to share their health information for research if it could help improve the care of other patients, even in situations where the research would not benefit them personally. And also 2 in 3 considered it important to know which studies their health data had been used for. And also things that were considered important were the ability to remove their data from research data and the notification of data being combined with other data sources. And 60% said that they would be disappointed if an external data protection authority prevented their data from being used in a study, even if they had given their consent. And I think this highlights how important it's for patients to be able to participate in and support research and to decide for themselves how their data will be used. And this is I think there could be similarities in terms of mobile apps as well.
Thank you, Emma. And in your opinion, what are the 3 most important features a mobile health app should have to be fully accessible to patients? I think you mentioned some of them in my previous question, but do you have additional features?
Yeah, and that's a very good question. It was really hard to think about where to reply what. So this is a continuation of the previous question. So I think mobile health apps should ensure to be user-friendly and easy to navigate. Those are maybe of the more technical features, but this could mean a clear and simple design for users of all ages and abilities. So I think the health literacy aspect comes to play in this respect as well. And this goes on a practical level. This could mean to imply voice assistive features and speech recognition, maybe personalization options, and the opportunity to customize the features to meet more personal demands. And of course, the mobile health apps must be effective as well. I think I'm going over the three things as well, but just to add shortly, I think the time usage is also of essence. So patients don't want to spend extra time on an app they don't like, they don't know how to operate, or they don't know where their data might end up with. So digital solutions, for example, in communication with one's healthcare team can additionally assist in reducing travel time and costs for patients, especially in countries or regions with long distance to healthcare services.
Can you share some examples of digital health technologies that, in your opinion, have significantly improved patient care?
Yeah, sure. The first example is Nona. It's a digital patient-reported outcome platform for clinical use in patients with care, and it's designed to support cancer patients during their treatment by facilitating real-time symptom monitoring and communication with their care team. And this one is used in the Helsinki University Hospital in Finland. And I checked a pilot study that assessed the suitability of the Nona platform, and they'd conducted an interviews or surveys or with patients, and most of the participants in this pilot study felt that Nona appeared reliable and it was easy to use. Things also I mentioned earlier. And the platform was redeemed a useful tool for monitoring patients' symptoms during cancer therapy. So there was an actual need that was applied in reality. And there are many digital health technology solutions. And personally, I've had the experience of using the MISA app that's used in the public healthcare in the Helsinki area. It's a bit robust since it covers everything from basic healthcare to specialized healthcare to dental care and everything, and vaccinations as well. So it has everything in one place, but it's a bit robust, but it works. And you can check your joint patient records, information on upcoming appointments, etc. And also, maybe a small third example is within mental health. There are really good results, and I'm sure this is not only in Finland but elsewhere as well in digital treatments or online therapies assisted by an actual therapist, and the online assisted therapies can be as effective as face-to-face psychotherapies, for example. And also this is maybe to answer the previous question you raised about the about or what we discussed about transparency and including persons with from different ages and abilities. And our association had a project that ended last year, and it was aimed at developing digital solutions to combat emerging challenges cancer patients and their loved ones face when they use digital healthcare services. So everything is online these days, but there are persons who are sort of left out or are not in the cycle of finding out, and they have no expertise or know how to even operate a mobile phone, for example. So we provided training, for example, for the elderly and immigrant communities as well, so that they would find out more, and also to ease their access to and provide information on the Finnish healthcare system. So equity and participation of potentially underrepresented persons is also very important. And to mention again, the health literacy must be with when you develop digital health technologies.
Thank you, Emma. I think our listeners will like to know about this app, so it's very useful that you brought these examples. But now discussing a bit more about your experience in the EDiHTA project, what were some of the most valuable insights you gained from participating in the focus groups?
Yeah, thanks for the question. I was really excited to join the focus group, and it was also wonderful to learn more about other disease areas or conditions, and what their maybe specific concerns or challenges are when it comes to telemedicine, medical devices, and mobile health apps. And it was also very rewarding to get out of the cancer box for a while, or niche. And also, I think it was really an interesting opportunity to learn how focus groups function within EU projects in general. So that was also a learning opportunity. Initially, I was excited to join the patient advisory group to learn about and contribute to patient involvement and share our experiences from the Finnish and Nordic processes. And I'm still very happy that I joined the project. It's been a pleasure. And after the focus group session, and before the members of the patient advisory group were able to comment on the draft report, I also reached out to other patient organizations in Finland and received some responses, especially on medical devices that I'm not so familiar with. So they were really helpful, and those issues could also be incorporated into the project. And I think, just to add one thing, I think patient organizations need to collaborate more, also in the field of digital health technologies. And EPF forms a unique forum and represents the patient community in Europe. And I think much more work needs to be done in disease-specific areas, but also jointly with other diseases and conditions, like in the EDiHTA project. So we don't exist alone, but many of the patient challenges are shared concerns, no matter of the diagnosis.
Thank you. That's really amazing to hear how your experience was. And a bit more about the future. How do you envision the EDiHTA framework influencing the adoption of digital health technologies across Europe?
Yeah. I really look forward to learning more about when the project develops and develops the framework. Well, I envision that patient involvement in digital health technologies is a fast-growing and evolving realm. It didn't appear last night. It's been going for decades, but much needs to be done, like I said. And I think evidence-based information really strengthens, like in the case of the EDiHTA framework, really strengthens patient involvement. And I'm very glad patient advocate involvement is strongly adopted into the project. The sometimes wild sphere of mobile health apps needs needs better regulation. I think that's a concern, and really I believe the EDiHTA framework can really make an impact in this sphere. And there are all many good practices to learn from that are currently being developed in the EU HTA procedures. For example, in medicines, some of the legislative issues can certainly be applied to adopting digital health technologies as well. And also maybe looking further in the future, I think the results from the EDiHTA project can also be further disseminated through EPF and, for example, the Digital Health Working Group. Good practices from the EU level and umbrella patient organizations can also additionally be made to good use at the national level. I think that's one step to concern as well. And nobody should have to reinvent the wheel all over again. So there were really good things happening in the EDiHTA project. One example to raise, Finland is in the process of establishing its first ever national cancer strategy, and it's a part of the strategy concerns patient involvement and human-centered services, and it's been a huge process of over 200 experts and patient advocates involved in the design of the strategy. And I hope that future updates in patient advocacy are also incorporated into the strategy at a later stage as well. And just to conclude, I envision that patients also require additional training on the EU legislation and its practicalities. And I think here patient organizations or platforms are of great essence. It's been a pleasure to learn through the EDiHTA project. I really look forward to the release of the report.
Thank you, Emma. It has been a pleasure to talk to you today. And stay tuned, as we will have another episode on the EDiHTA Talks series soon.